I'm a professor of visual functioning and health. I was appointed as a professor last June of a research group which is called Low Vision Research. And we do a lot of research about the impact of vision loss.
My project is about dual sensory loss, which means that one has a visual and an auditory impairment. And this combination can cause considerable challenges. Well, my girlfriend has visual impairment, so I was already familiar with this target population. Well, recently I conducted interviews with people with dual sensory loss, so it was really look in the personal life of these people. And well, then you can really see what kind of challenges they face. So I'd really like to make life a bit easier for them.
Quite a large group, I think, so we're quite with quite some people doing this work, and well, I can even say that in some fields we are kind of leading. So especially when it's about mental health, there are only a few groups worldwide who are also busy with this topic, and I think we are one of the groups who are trying to do really good work with that. So our care innovations are really something else, I guess, than what other people are doing. So
developing a viewing test for glaucoma patients, the TriScan, and in this test glaucoma patients wear an eye tracker whilst watching videos of traffic situations. And we will measure their compensatory eye movements and scanning strategies in order to see if they compensate for their visual field defects. We hope to give glaucoma patients the chance to retain their driving license in a safe manner. It's about researching what is possible and not what is not possible.
Well, I think sometimes ophthalmologists forget about that a patient has a life and it's not just the eye. So what we like to contribute is that we're helping the whole patient and not just try to fix the eyes, because sometimes that's not possible sometimes anymore. So if people have irreversible vision loss, you cannot treat it sometimes anymore. So people need more than that. They need to cope with their vision loss, and of course everybody wants to stay independent and live by themselves with their families, and so that is my whole motivation to make that possible for people.
I'm visually impaired myself, so I have a lot of experience with problems that are experienced by people with visual impairment. My research is focused on light. We look at the influence of sunlight on mental health and on quality of life in people with visual impairments. And I want to contribute to better interventions and better treatments to help these patients for improving their mental health. I think people with visual impairments can experience problems, and they can miss some guidance to improve the quality of their life. So that's why this research group can help to provide guidance for these people to improve the quality of their life.
Vision loss is something you cannot often see from the outside, unless people are almost blind. Then sometimes you can see somebody walking on the street with a special cane, for example, or a guide dog. But there are so many elderly people who have serious vision loss, very severe vision loss, and you cannot see it from the outside. So we're kind of giving these people a voice too, through our research.
We need to tailor it to every individual. And we developed some interventions, for instance stepped care interventions, in which we can use low intensity treatment to help people improve their quality of life and mental health. And I hope with the research that we are performing, so the practice-based research, that we can improve their lives a bit and help them regain control over this difficult situation in which they are encountering so many obstacles and difficulties in daily life, when you get a visual impairment. So.
But on the other side, you have the impact of vision loss, and I would like to connect these two. So I want to show people that what we're actually trying to prevent by showing the impact of vision loss.
Part of my project is a big data study based on health insurance claims data, and a qualitative study based on interviews with healthcare professionals and patients. The results of my study may provide policy makers with suggestions to enhance access to low vision services.
I am developing a new questionnaire, vision-related quality of life questionnaire for patients suffering from retinal diseases such as macular edema, macular degeneration. And we will make this questionnaire computer adaptive, so only a few questions needs to be answered by the patient. My research will contribute to improve the healthcare of patients with vision impairments, and I think this is possible if we bring the patient perspective in clinical practice.
People with vision loss, they sometimes really have these existential questions about life and about the meaning of life, and sometimes they start to get feeling depressed also, and I would like to connect also the ophthalmology department to social work, for example, so to show that this is really something normal, that you start to think about these things when you start to lose your sight, when it gets darker and darker visually, but also mentally in your head.